Welcome back to WBRZ News 2 at 4. Dr. Z is here today, and we're talking about ways to combat losing hair. It happens, but there are ways to slow down the process.
Actually slow it down and reverse it in some cases. So that's good news because it affects so many people. It actually affected me 10 years ago. And it is very psychologically damaging. It can be. In fact, there was a study and it said 60% of people, if they had the choice between a head full of hair and more friends and money, 60% of people would take more hair.
Wow.
So that's significant. So I'm going to go over the ways that we have both prescription and over-the-counter.
Okay.
And then also there's a new treatment that we have, and we have some before and after pictures, and we'll discuss about that.
Okay.
So the first thing is, what causes hair loss? There's so many different things. Pregnancy, stress, both physical and emotional. So you can be sick with a high fever or have surgery. You can have the death of a loved one. And actually 2 to 3 months after that stressor, your hair falls out. So it's kind of, if you know you're going to go through a stressor, you can do some things preventatively. And then also just menopause, going through life changes, starting or stopping birth control pills. There are a lot of drugs that can do it. Of course, radiation from and chemotherapy for cancer can do it, but also some drugs that you wouldn't even think, such as ulcer medications, stomach ulcer, over-the-counter, Zantac, Pepcid. There are also medications for high blood pressure or heart problems, such as beta blockers. That's a class of medications that can cause hair loss. And even statin or cholesterol medications can do it. Antidepressants or anti-anxiety medications, SSRIs, serotonin reuptake inhibitors, such as Paxil and Zoloft, and those are widespread. The usage of that is widespread, so a lot of people are on it. To start looking at your medications and questioning and asking your doctor, those are some things that can do it you may not even think of. So what are some of the over-the-counter ways you can treat it?
Yes.
We have some right here in front, and Rogaine is one of those. And I like men's Rogaine for both men and women. And you can use it morning and night. There's liquid and foam. This happens to be the liquid. These are some vitamins that are only available in doctor's offices. It's a Viviscal Pro, but they also have regular Viviscal that you can buy at over-the-counter places. And then over here is a prescription called Finasteride, also Propecia. And then this is the newest kid on the block, and this is A-Cell. And we actually mix this, and it comes in this little bottle in a powdered form, and we mix it with your own blood that has been spun down, and we remove the platelets, or the platelet-rich plasma. And we mix it with this powdered form, and those two together, the platelets have these growth factors in the granules, and this...
We have some before and after pictures.
Yes, we have some before and after.
At that.
And this stimulates the stem cells in the area.
Oh, wow, that is quite a difference.
Amazing. This is one treatment.
Wow.
Amazing. And so basically this is fertilizer for your hair.
And how much does that cost a treatment?
Depending on the area of the country, $3,000 to $5,000, and you do it once a year to once every 2 years.
Okay. Wow.
Yes.
I mean, those pictures are amazing.
Amazing.
Wow.
Really amazing.
Okay. Well, we have a basket to give away today. That is for the number on your screen. That's 336-2321. 336-2321, and that's for caller number 10. You're watching WBRZ at 4. We will be right back.